Yeah, good evening, everyone. I am Dr. Ritesh Vernekar. I am a professor in nephrology in JNMC Belgaum, KL Hospital Belgaum, and a transplant physician and a consultant nephrologist in KL Hospital Belgaum, which is in Karnataka. So today we like to discuss few of the aspects regarding the chronic kidney disease. First, we'll see the definition of chronic kidney disease. We'll see the stages of chronic kidney disease. Then we'll discuss the causes of chronic kidney disease. Then we'll come to the investigation part and the investigation part of the chronic kidney disease. Then we'll see uh, what are the line of management of chronic kidney disease. What are the vaccinations involved in the chronic kidney disease management? So, uh, first of all, we'll see what is chronic kidney disease. So chronic kidney disease is called as chronic CKD. It's chronic kidney disease. It's a irreversible kidney damage, which is over a period of 3 months. Either it may be anatomical damage or the functional aspect of the kidney damage. So anyone who has proteinuria of more than 3 months, creatinine elevated more than 3 months, is called as chronic kidney disease. So coming on to the etiology of chronic kidney disease, the most common etiology is diabetes, then comes the hypertension, then polycystic kidney disease, then the glomerulonephritis, then the obstructive kidney disease, then miscellaneous like alternative medicine induced kidney disease. So the most common cause worldwide is a diabetic kidney disease, which accounts to 40 to 50% of the cases. Now come to the stages of the chronic kidney disease. There are 5 stages of chronic kidney disease depending on the GFR. The stage 1 GFR less than 90, stage 2 GFR 60 to 90, stage 3 GFR 30 to 60, stage 4 GFR 15 to 30, stage 5 GFR less than 15. And coming on to the clinical features of chronic kidney disease, unfortunately, there are hardly any symptoms for the initial diagnosis of chronic kidney disease. Still, we have some subtle clinical features or very early clinical features of chronic kidney disease, like swelling of feet, puffiness of face, uh, easy fatigability, then loss of appetite. They're very early changes. Later, the patients will have nausea, vomiting, breathlessness, pruritus. Sometimes they may have hematuria. So unfortunately, early we don't have much symptoms. That's why we have to we have to be relied on the laboratory investigations. For the early kidney disease diagnosis, laboratory investigations are very important. Like we should check whoever patient is a diabetic or hypertensive, we have to check every 6 monthly the creatinine and the urine routine. But creatinine and urine routine are the earliest clue which will help us to diagnose early kidney disease, like creatinine high, more than 1.2 in male, more than 1.1 in female, or there is proteinuria. They are the earliest clue of chronic kidney disease. Later, they will have anemia, hypokalemia, hyperphosphatemia, hyperthyroidism, then hyperuricemia. So, earliest are proteinuria and creatinine. Now, coming on to the vaccination part of chronic kidney disease. So we have to vaccinate them with the influenza, pneumococcal vaccines, chickenpox vaccine, and some selected cases who are not vaccinated in childhood, we have to vaccinate them with diphtheria or tetanus vaccines. So coming to the management part of chronic kidney disease, management parts involve dietary approach, salt restriction, avoidance of non-vegetarian diet, avoidance of junk foods, avoidance of carbonated beverages. Then the sugar should be controlled well, hypertension should be controlled well, calcium should be controlled, phosphorus level should be kept adequate, PTH level should be kept adequate, uric acid level should be kept adequate. So once anemia should be corrected, once the disease progresses, then we have to counsel them regarding the forms of renal replacement therapy, like hemodialysis, peritoneal dialysis, renal transplant. If they don't have anyone as a donor in their family, they should be enrolled in the cadaver list. So the requirement of hemodialysis timing is important, and the nature of dialysis is important. Not everyone tolerates hemodialysis well. Some patients require peritoneal dialysis, or some patients require the hybrid model hemodialysis with peritoneal dialysis. So we have to see which form of treatment suits the individual. And the social care, multidisciplinary approach is most important. If any cardiac disease is there, the cardiologist should take care of the patient with a diabetologist, zeropodist, neurologist, gastroenterologist. So it's a multidisciplinary approach. And more in the multidisciplinary approach, the social factors and social care is most important. So, and the best option for the management of kidney disease is a renal transplant. If they have donor as a for renal transplant, it is the best form of treatment. It's about chronic kidney disease. Thank you.